Hi everyone, Dr. Nemechek here. I want to touch on another case we had with that involves a child with failure to thrive. If the kids are older, they might use a term like short stature. So here's a child about 3 years old and was in clothes for a 1.5-year-old, 18 months. And the clothes were even kind of baggy at that point. Child had a bunch of difficulty, autism, developmental delay, really bad diarrhea for most of its life, and we tried the inulin. They had an allergic reaction to that. We tried some the PHGG, the partially hydrogenated gargum, and that seemed to make the behavior much worse, which I hadn't seen that before. That's very unusual for PHGG to do that. But we were kind of then forced into giving a little trial using rifaximin at a very, very low dose. And within just a couple of weeks, diarrhea had cleared. Stools are normal. We had a nice awakening, good eye contact, more responsive, calmer, things like that. And I see them at the 4-month follow-up. So there's a lot of nice developmental gains starting to occur. But what was really interesting is we go from a child that is in 18-month-old clothes, is now grown so much that the mom says, the child's about ready to grow out of 3-year-old clothes. And she's 3, 4 or 5 months old. So big boost in muscle mass, height. And we see this frequently in these little kids who are, very underweight, very short, and when we put them on the protocol, we get these substantial improvements in height and weight. Now, they don't turn into giants. They just really catch up to everybody. And this is supported by the literature that whether it's Africa or South America or Bangladesh, these studies looking at failure to thrive or short stature, these kids, all these studies are showing these kids have bacterial overgrowth. And I even know of some pilot projects that are going on, like there's one in Africa and one in South America, where they're just giving these kids a little short course of antibiotics, trying to shift the gut bacteria enough to see if they can get them to start growing. So we don't know the exact mechanism. Is it lack of nutrition, or some other hormonal factors involved? Is it the inflammatory stress maybe making normal growth hormone or things not working right? We don't know. But it's very effective. So if you have a child that might fall into this one of these categories, you might want to consider the protocol and see if you can get them to start growing more normally. All right, that's all for today. Everybody have a good day. Bye.